Good evening, everyone. I hope everyone had a lovely day and you're not too tired and you've managed to recover from work or school or everyday activities. I have today with me Petya, my colleague and twin. Then we have our guest from Industry Support X, Maria. She will as well talk to you about different sport garments and how you can access their service. Just before we start, if you have any questions, either put them in the chat, as Pedro said, um, or just write them down, whatever is easier for you. And then at the end, there will be time for questions, so you can ask any questions after. So, as I said, today's topic is hernia prevention, and our guest is SuportX, which is a company that provides garments for hernia support belts. Now, the aim of the day is for you, whoever doesn't know us, to meet our twin team. We then have introduction to what hernias are, how to prevent them, if you have some, how to manage them, and then Marie is going to talk to you about different support garments out there. Here's our twins team. As you can see, Petty and I are twins. It's in the name. We are both ipouch and stoma advanced nurse practitioners, which allows us to work on advanced level of nursing and support everyone with a stoma or an internal pouch or ileoanal pouch. I'm not going to bore you with what stoma and pouches are. We're just briefly going to say what a stoma is. I'm sure most of you know that it's a surgically created opening in the abdomen, which serves to divert waste, whether it's stool or urine, outside of your body. Now, having a stoma means that you would wear a stoma bag at all times, which would be attached to the skin to collect the waste. On the other side, an ileoanal pouch, or what you would hear us here in our twins service say ipouch, is again surgically created reservoir. It is inside the body, it's internal, it's created from the small intestine, the ileum. It happens after your entire colon and most of the rectum are removed, and then the ileoanal pouch is created, and it acts as a new rectum, new reservoir where bowel content is stored until you go to the toilet the natural way. On the other hand, what is hernia? I'm sure that many of you have heard about hernia in your life and what it may entail, how it may look. If you see here, there is a picture of a example of hernia. It usually appears as a bulge. Hernia in itself is a condition when an organ or tissue pushes through a weak spot in the surrounding muscles or connective tissue. Now, there are various types of hernia, inguinal hernia, hiatal, incisional. Today, we're going to focus mostly on parastomal hernia, stomach closure site hernia, which is the type of hernia you may have at the spot in your abdomen where a hernia stoma used to be, and perineal hernia. There are different high risks for hernia. Very often, people immediately after surgery, the first 8 to 12 weeks, are told to be more careful as the risk is higher at this time. On the other hand, there are different risks that may or may not be related to you having a surgery. For example, the patient-related one or your personal to you, it would be things like your age, your weight, whether you do anything related to heavy lifting in your everyday life, whether you smoke. Malnutrition is a factor. Chronic constipation, when you push and when you go to the loo, you create this increased intra-abdominal pressure. Same goes for pregnancy. Weak abdominal muscles can as well make it possible for a hernia to make its way to that weak area in your abdomen. Lifestyle again and type of work that put you at higher risk. females tend to be at higher risk. And the other thing is increased abdominal pressure, whether it's through chronic or coughing or just you have really bad flu and lasted a week or less. After surgery, if you are vomiting, coughing as well. Again, if we go back to the surgeries, higher if your risk is quite higher if you had multiple abdominal surgeries, emergency surgery as well. If during surgery there was abdominal defect or you have poor abdominal wall support, that again has to do with multiple surgeries. If you had wound infection to the abdomen, that would weaken the area as well. Steroid therapy, some people with collagen disorders, if you are undergoing radio or chemotherapy, and or if you currently have a cancer or diabetes. And for those of you that have a stoma, having a stoma in itself has its risk. For example, if the stomach construction had its defect, or it was formed outside of your strong abdominal muscle, which is your six pack. We all have it, whether you, some of us hide it better than others, but we all have a six pack. Now, certain types of stoma put you at higher risk, for example, loop and double barrel stoma, an infection around the stoma, or the size of the stoma after surgery. If you imagine if your stoma was quite large, quite swollen after surgery, and the surgeon needed quite a bit of space in the abdomen to bring it out. That as well is going to leave a big opening in the abdominal wall. And lack of stoma marking before surgery. What stoma marking is you see a stoma nurse who sits with you in clinic, makes you sit, stand, bend, lie down, so she can find the best position for your stoma. Some of the most common symptoms of you having a hernia would be having a bulge. You might have pain, discomfort, or heavy sensation around the hernia as it enlarges. Now, if you think about it, many experts actually say that formation of stoma in itself could be considered a hernia. Why is that? If you imagine a stoma, as we said, it's a surgically created opening into the abdomen, and the intestine is brought up through this opening. Here, if you can see on the side, the process of the stoma being fashioned, you have a cut in the abdominal wall, then the bowel is brought up, and the stoma is fashioned there. So going back to what hernia is, as we said, it is a pushes through a weak spot in the surrounding muscles. So a stoma is formed from an organ, which is your intestine, that pushes through a weak spot, which is your surgical opening, and the surrounding muscle, connective tissue. Now, it's interesting as well to know that in some cases, your risk of developing hernia with a stoma might be as high as 50 to 60%. That, of course, depends on your type of stoma, types of surgery, and your lifestyle and other personal circumstances. Incisional hernia, it occurs when the tissue or part of your organ pushes through the surgical incision. So imagine where, especially if you've had open surgery, this is usually that weak spot that it can find its way. And as incisional hernia, we include as well the stoma closure site. So if you've had at some point of in your life a stoma and then it was closed, many of you would actually have that closure site left to heal on its own, not closed, so it heals from the bottom up. So this is where is a weakened area in your muscle, so it might lead to hernia. Now, perineal hernia is not that common, and people and clinicians do not talk about it often, but it may happen. Now, when we talk about perineal hernia, imagine your pelvic floor muscles. They're like a supportive hammock for the organs that sit in your pelvis, like your bladder, rectum, intestine. So when you have a perineal hernia, part of these organs pushes through the weakened or damaged area in the pelvic floor muscles. and then it forms a pouch. Again, it could be due to surgery, different other injuries, or pregnancy. Now let's talk about how we can prevent hernias. We like to say that prevention is the best, is better than needing treatment. So some of the tips we have for you today are using a low roll technique when getting in and out of bed, which I'll show to you shortly. Using hernia support garments, practice safe lifting, doing abdominal core exercises, applying abdominal support when coughing, sneezing, or vomiting, especially after surgery. Avoid heavy lifting, avoid twisting movements, avoid high impact cardio and high resistance exercise, especially after surgery. And if you smoke, please do quit smoking or at least try to reduce. Now, this is the lock roll technique you should know how to do, especially immediately after surgery, the first few weeks. You can see it is a technique that allows for you to use your strong arms to push yourself up rather than putting that straining and pressure on the abdomen when you lift yourself up from the bed. Basically, you need a little cushion. If you don't have, you can just put your arms around your abdomen. Then you use your arm to push yourself up, and that's how you lift yourself up. Now you just use the reverse steps to get back into bed. Go on your side again using your arm and down to the side, and then you go on your back or remain on your side, wherever is easier for you to sleep. Here are some examples of hernia support garments. I'm not going to go too much into details about them, as Maria can talk to you about this. As you can see, there is a wide variety of them. There is, for those of you that have a stoma, often people say that they feel like it's pressing on their stoma back. So they're little shields that you can place over the stoma back. It is more important to lift safely than us telling you how many kilograms you can or cannot lift. Because if you imagine, we are all different people. For one 5 kg could be a lot. For others, 20 might be not a problem. So what we do tell you is to lift safely. You need to bend your knees, keep the object close to your body when you lift, and avoid straining your abdominal muscle. Because when you do, that's the thing that puts that pressure on your abdomen. Now, as part of prevention, the most important thing is as well is doing a light to start with and gradually progress abdominal exercises to strengthen your abdominal core muscles, which are again these muscles we talk about, your six pack and all your muscles in the abdomen. Now, these are some examples of exercises we suggest to people to use. You can do them even in hospital in your bed. As you can see, they are not exercises that are quite difficult. You can always tailor them to your strength and how you recover. You can start with 5 repetitions, then see how you progress, increase it to 10, and so on and so on. As you can see, all of them, most of them require you just can be lying in bed or on the floor, but even some people do start doing them in hospital. Obviously, don't push yourself too much because you've just had surgery. You don't want to as well start doing 300 of them in the first day after surgery. Now, as we said initially, especially after surgery, things like coughing, feeling like vomiting or sneezing, or even if you're having cold, these are things that may happen. So it's always helpful to either place your hands on your abdomen where the surgical incision is, or small cushion or rolled up towel. Many of you probably, when you've been in a hospital right after surgery, you would actually have a rolled up towel, and which is um, taped with tape so you can actually use it at all times. If not, you can just make it yourself at home or just use a cushion or your hand. Again, as I said, for us, it's more important when we talk heavy lifting, again, especially the first 8-12 weeks. You can see some activities can put quite a lot of pressure in intra-abdominal pressure, so it's important to be careful. So um, don't go in the garden carrying bags of all kinds of things that are quite heavy, or moving furniture, or pushing heavy trolleys. It's always a good thing to start with small objects. And as I said initially, the lifting technique is more important than how much you lift and what you lift. Twisting movements again put a lot of pressure on your abdomen. So things like vacuuming or mopping, things that are everyday activities, can put such pressure. So some useful advice is, yes, you have had a surgery, but many of us need to return back home, and you still have your responsibilities. You can't just sit and not do them. So there are some useful things you can do. You can dust with extendable duster, or use some of these upright vacuums that you don't require bending and twisting, or have those tiny robot vacuum cleaners. Or if you need to fold laundry or things like this, just fit, and that's quite helpful. Again, all these high impact exercises, they're good for you in the long term. Probably months after surgery, you want to start first with light exercises, walking. You don't want to return a week after surgery and be doing all these exercises like running and jumping and weight lifting, as this can put quite a lot of pressure on your abdomen and intra-abdominal pressure. And as we said, smoking is a risk and is quite a high risk for hernia. So seek help if you need to stop. You can try having nicotine patches, or ask your GP to refer you to smoking cessation services. These are available around the UK, so you can be referred, and that can help you. Now, sometimes the hernias can cause complications that you need to be aware of, things like blockages or actually strangulation. So what happens is the intestine is trapped when there is strangulation and the blood supply is cut off. So this is more common with parostomal hernia than incision or perineal hernia. It is a medical emergency if you have a strangulated hernia, as this can cause the intestinal tissue to die. So what are the signs of strangulated hernia? If you have a stoma, the stoma becomes dusky, dark black, or necrotic in color. You may be nauseated, vomiting, as nothing is moving in your intestine. You can have sudden or severe pain, and your stomach stops working or output is decreased. For the rest of you, the hernia bulge itself can turn red or purple, the skin itself, or dark. So if you suspect that you have any of these symptoms, it's crucial to seek medical attention immediately. As I said, it could be life-threatening if you really have a strangulated hernia and the blood supply is cut off. We, as a service, in case of an emergency, you can always contact us at any time, as we are open 365 days a year out of hours. We have video, telephone, face-to-face consultation. We can see you at home if you live in London area, and we have national advice lines, also rapid response team. So if you are unsure and if you think you might have any issue with your hernia or anything pouch or stoma related, you can always contact us. How you can contact us if it's urgent support. You do not require referral. Otherwise, referral from your GP or surgical or gastroenterologist may be needed. But the most important thing we do need from you is your full past medical history. The reason why you need to see us, whether it's ongoing ipouch or stoma nursing support, well, any recent clinic letters. Now, our team can provide care, as I said initially, for any ipouch or stoma patient, as our nursing team operates at advanced nursing practice. So we can do a lot of complex and advanced procedures. Well, we will inform your consultant or your GP if they need to perform any procedures or they need to order anything. As we like to say that we operate on no ipouch or stoma patient left behind. As I said, sometimes we may not require your GP to or consultant immediately to send a referral. We might, or at all, we might just ask you to complete our ipouch or stoma passport, which is really your personal details, any medical history, past medical history, medication, so we know we don't miss anything and we can provide the best care for you. Now, many of you that have contacted us in the past know that we now have we provide you with a link online so you can go and actually complete the registration passport form there. And that's why how you registered. This is our contact details for those of you who don't have them. And you can, as I said, you can contact us at any time. This is our WhatsApp channel. It's more of a like a news feed. You don't participate there with comments. You kind of get updates from us. So if you wanted to join, just feel free to. Thank you. And what I'll do now, I will stop sharing so Maria can start her talk with you. Maria, to you.
Yeah.
Hope everyone is okay.
So, good evening, everyone. My name is Maria. I work for SuportX for many years now. And a few words about SuportX. SuportX is a British company. What we do abdominal support garments. And at the moment, SuportX is the market leader for the UK market, and we're present in Europe, Australia, Ireland, yes, Canada, US, almost everywhere. So today we're talking about hernias. Many people are affected by a parastomal hernia. Once we have the operation, we need to adjust with the stoma, but also with the presence of a parastomal hernia and the way it affects the stoma, the choice of a stoma bag, the skin condition, and in general affects our ability to manage our daily activities. The NHS spends over £1 million in the provision of support garments, and yes, that's a cheaper choice than a hernia repair operation, but it's very, very important to select the appropriate type of garment. If we have the appropriate support garment, then we can avoid costly trials and not waste money and resources. Many studies show that support garments are used to limit visibility of the stoma and the stoma bag. So it's the desire to conceal the stoma bag when in public, cover the stoma bag during intimacy. And if a support garment works well, can offer somebody the desired body image. works like an armor and makes us feel more confident. So main concerns over sexual activity, fear of accidents, odor about the stoma have been reported in the literature since the early 70s. So let's see what patients have to say about the stoma and stoma bags and support garments. Many patients eulogize about how life-changing support garments have been, giving them the freedom to socialize again. People believe that having a garment makes the stoma bag not only more secure, but less likely to catch or rub on another part of the body. In general, gives confidence. But today, I would like to focus more on what people have to say about the support garments, why they're using them, why they like them, why they're not using them, and why we don't like them, what are the problems, and most importantly, what we as SuportX, as a company, what we can do to address these problems and to answer these questions. So let's start with the easy part, the positives. So people, yes, use the main reason is they use the support garments to prevent a parastomal hernia. The threat of a parastomal hernia preoccupies many patients, and they manage this stomach complication by wearing support garments. Well, we call them support underwear, support belts, hernia vests, hernia belts, many things like that. And we have two examples here. A gentleman saying that I strongly believe that stoma nurses and surgeons should tell people about stoma products and accessories. I love my support garments and I find them very helpful, reassuring and comfortable. They increase my confidence. Whilst I'm not back in exercising, yet I'm confident that the garments will massively help me to reduce my risk of developing a hernia. So it's hernia prevention. The same for another lady that she wears the support garment whenever she's doing anything strenuous to prevent, again, a hernia. Pain management and hernia support. Now we're talking about parastomal hernias. So we're talking about people that they already have a parastomal hernia. People feel support garments provide support, reduce associated pain, and can prevent a hernia from growing any bigger. Which is, yeah, true, especially that dragging feeling all the time if you have a hernia. So again, hernia support, body image, future health. Many people believe that by wearing a support garment, they will have less chance of developing a hernia, thus protecting their body image concerns and future health. So, for example, a lady here says, I have to use them daily. I have had 5 major surgeries in the past 10 years, so I need to support my 5 hernias as much as I can so that I don't have any more surgery. So now we are on a different stage where we need to stop a hernia from growing bigger and also feel more comfortable. Discretion, confidence, and obviously support. Some people with or without a parastomal hernia will feel safer while wearing a support garment, which helps them to forget about the stoma. They feel exposed without the support garment. So, an example, I feel unsafe, open, no support when I don't wear my support underwear. I do try every now and then to wear normal underwear, but always go back to my support undies. a young lady. Prevention against leaks and to feel less anxious. So patients also will use the support garments to manage anxiety about leaks from the stomach bag. Some people address problems with the stomach bag through the use of support garments. Well, yes, many times we see people that they will say, yes, I need my belt or I need my brief to keep my stomach bag next to my skin, makes me feel safe. So an example here, a lady, I have not yet come to terms with having a stoma. However, the support garments make the medical appliance less obvious under clothing, and I wear a support belt 24/7, which makes me a lot less anxious about having a leak. Well, we don't have to wear support garments 24/7. Obviously, it's a personal preference. But yeah, when we do anything active, yes, it's advisable. So let's now move to the other side. What puts people off? Why we don't like them or why we don't want to use them? Incorrect sizing, basic. Getting the right size and fit is essential for how we look with our garment, but also to allow the stomach bag to work. So many people complain about support garments being too big, too tight, too small, too long, too large, anything. And also they say that they have a difficulty of getting the support garment that fits their own body and the stomach side. One example here, a lady says that I have a very high stomach. It is about 2 inches below my boob, and I find it hard to get clothing, underwear, and things to cover it, so I wear tops that they are 2 sizes too big. And another lady, it's on the other side, I have a low-level stomach. This has made it impossible to wear most of the prescription garments, either because the security pouch is too high, probably he talks about the light support briefs with the pocket inside. Obviously, if the stomach is too low, that pocket will be too high, or bands, means belts, they roll up and down, struggling with my stomach. Yes, because if the stomach is too low, a belt looks more than a mini skirt than a belt. So again, incorrect sizing, licking, pancaking, or ballooning. There are negative reports about support garments in relation to body function. Ill-fitting support garments are believed to cause leaks, pancaking, and ballooning. To be honest, ballooning has nothing to do with the support garment, but if the garment is not right, and we have that, well, ballooning happens if you have a stoma sometimes, then it won't work well. So a gentleman here, a lady here says that her belt was made from rigid plastic and digs into the abdominal scar, caused pain, eczema, so she can't use them. That's it. Or another gentleman says support underwear, they're not always high enough, and especially when the bag fills with air, so the bag pops on top of the garment. Or another lady says that they feel too tight and she's afraid that they will squish the stomach and cause leaking under the flange, the base plate. Some people report that support garments are restrictive. Again, we go back to their own size. Another discomfort is feeling hot and sweaty. Yes. And a few patients criticize support garments that they look too clinical and lack of style? Yes, sometimes they do. So let's go to another group of patients that they use the support garments, but they don't think they are comfortable. There are some people that they have big hernias and they know they have to use something to move around to support themselves, but they still have their own garment. So despite the lack of comfort, many patients continue to wear support garments, suggesting that their perceived benefits outweigh discomfort. So that's okay, but it's not right. So what we can do as a company and what we do. So first of all, we have a really wide range of products available, different levels of support, light support, moderate support, and really firm, strong support, different styles and types, like adjustable belts, pull-up belts, briefs and shorts for men and ladies. Definitely different sizes are available, from whatever extra small to whatever extra large. And because everybody's different, and although, yes, there are so many different sizes and garments available, still sometimes we need to go for a bespoke garment to meet everyone's needs. So there is a bespoke garment facility available. Also, because they are medical devices and we're trying to avoid costly trials, we have a team of 12 colleagues and we cover the whole of the UK, and we offer a free fitting service. So it's either in a clinic or in a home visit. We will come and see you. We will have every size, every sample with us. So we will do the measurements. We will discuss your needs, what you need and your preference. And then you'll have the chance to try different garments on so we can choose what's right for you. Now we were talking about the fabric. So our products are made from breathable fabric with cotton fibers that will reduce the moisture, and so we will feel more comfortable, not sweaty or hot or anything like that. The fabric will stretch 4 directions. They are especially designed to be worn over stoma bags, which is very important. And after all, after surviving an operation like this, the idea is to live. After a stoma formation, a new relationship with our body is in progress, and support garments can make a person become someone who happens to have a stoma rather than being defined by it.
Thank you, everyone, again. So we wish you a lovely evening, and we will be back shortly in the next few weeks with more news about our next webinar. So we'll see you soon. Have a nice evening.
Thanks, everyone.
Bye,
Take care.
everyone.
Thanks.
Thanks.
Bye.
Bye.
Bye-bye.
Bye.